This is my skeletal system TED Talk. Our bones in our body have basically 5 different functions. They support our soft tissues so that we may stand up straight and we can maintain our posture. Our bones protect us and our vital organs such as our heart, lungs, and most important, our brain. Our bones allow us to be able to move and serve as attachments for our muscles to help us be mobile. You can think of our bones as an actual warehouse that will house the important minerals such as calcium. Our bones store this calcium and release it as our body gets low on it. It is our red bone marrow where we find the production of hypnosis. Our human skeleton will contain 206 bones that are classified that we group in 2 different main subdivisions referred to as axial skeleton and the appendicular skeleton. When we talk about axial skeleton, we refer to the bones of the skull, such as a hypoid bone and the thorax, as well as the spine. The appendicular skeleton include the bones of our upper extremities and pectoral girdle, like our arms, our wrists, our hands, our fingers, and even our collarbones. The appendicular also contains bones of lower extremity and pelvic girdle, like our legs, our feet, our toes, and our hip bones. Our body also contains 2 other types of bones that may not be present in everyone's body. Sutural bones are small chip-like pieces we can find between the cranial bones. We may also find sesamoid bones in some of our bodies. We will find these small seed-like bones in our tendons where pressure will exist. We will find 28 bones in the human skull that we subdivide into 3 different categories. These 3 categories are the cranium, the face, and the bones of the ear. The cranium contains 8 bones and is responsible for protecting our brain. The upper part of the eye socket, the top of the cranium in the front, and the forehead will form the frontal bone. There are some important landmarks of the frontal bone, including supracipitral margins, supraciliary arches, glabella, frontal eminences, and frontal sinuses. These parietal bones will form most of the upper sides as well as the top of the cranium. The temporal bones will form the lower sides of the cranium that basically will surround the ears, and adjacent to this you will find the flat portion called squama. The zygomata process is a projection of the temporal bone that will extend forward. The mastoid process is a prominent projection of the inferior part of the temporal bone. The external auditory meatus, or otherwise known as the hearing canal, is a tunnel that will extend to the middle ear. The mandibular fossa is a depression on the temporal bone, and the carotid canal is a passageway. The carotid artery takes blood to the brain via the temporal bone. The optical bone will make up the lower back part of the cranium. The large opening in the inferior portion of the optical bone is the foramen magnum, and the optical condyles you can find in either side of the foramen magnum. The prominent tubercle located on the posterior surface of the optical bone is called external optical protuberance. The bone, also sometimes referred to as the bat-shaped bone, is called the syphenoid bone and helps make the lower floor of the cranial cavity, the eye socket, and part of the temporal area. It will have a colisure as a landmark and a paranasal sinus. The ipmoid bone also helps with the floor of the cranial cavity, the eye sockets, as well as the nasal cavity. The ipmoid bone has the landmarks cibriform plate, cristogala, the vertical or perpendicular plate, and the paranasal sinus. The second main division of the soul contains 14 bones in our face. The 2 bones we usually refer to as the bridge of our nose are the nasal bones. The 2 lamarical bones are located in the anterior medial portion of our eye socket. The vomer bone we can find on the midline in the bottom of the nasal cavity and helps to form the nasal septum. What we refer to as the cheekbone is actually called the zygomatic or malar bones. The upper jaw bones are the maximal bones, which actually is two bones. The alveolar process is where we can find the roots of our teeth. We can also find palatine bones in the bony roof of our mouth, although they are not as big as the maxillary bones. Our lower jaw is referred to as a mandible, which is the main horizontal portion referred to as the body, or the vertical portion of the ramus. The tip of our chin is a middle eminence, and this can also be known as the alveolar process. Inferior to the earlobe, you can find the angle. The mandibular condyle will fit into the depression of the temporal bone we refer to as mandibular fossa to make the lower jaw joint. Located on the lateral wall of the nasal cavity is a bony ridge referred to as inferior nasal concha. There are three different pair of small ear bones referred to as auditory ossicles, and these tiny bones are named for three shapes called malleus, incus, and the staples, and are located in the middle of the ear. The hyoid bone is shaped like a horseshoe and is located in the cervical region just above our voice box. Our spinal column are the vertebrae, and they're arranged for both strength and support. The spine consists of 26 vertebrae divided into several main groupings, with the upper 7 referred to as cervical vertebrae, with the most superior being the atlas. The other 12 are the thoracic vertebrae known as T1 through T12. The 5 in the lower back are known as the lumbar vertebrae, and following that is the sacrum, where the 5 of the developing child will fuse together. The last one is the tailbone, or the coccus. We will find the thorax in the chest that consists of the ribs, thoracic vertebrae, and the sternum that is considered to be a single bone, but during development was 3 with superior segment called the mandibular in the middle of the body, and the last called ipsoid process. There are 12 pairs of the ribs, with the upper 7 called the true ribs and the bottom 5 referred to as false ribs. Rib 11 and 12 have anterior cartilages called floating ribs. We have 126 bones in our appendicular skeleton that have both upper and lower extremities, plus the pectoral and pelvic girdles. The pectoral will include the scapular, or the shoulder blades, and the collar bones referred to as clavicles. The collarbones referred to as clavicles. We can find several landmarks in the scapula, such as the acromion and the conocoid process. At the end of the humerus, we find a ball-like end known as the head. The glenoid cavity is the depression of the scapula, which forms the shoulder joint. The inferior end of the humerus and the humeral condyles that form with the radius and the ulnar to make the elbow joint. What we think of as our elbow is called the ulnar process. Both the radius and the ulnar articulate with the wrist bones, or the cuppers, with a total of 8 in each wrist. Just below the wrist bones, we find the hand bones called metacarpals, with 5 of these in each hand. The finger bones are a series of finger bones called flagellants. The pelvic girdle is made up of oxcosa, with the superior board portion called the ilium, with its upper rim referred to as an alac crest. The inferior portion is called the ischium. Just above the general region, we will find the pubis, or pubic bone. Along with the two os, coxa and sacrum, and the coccyx will help make up the pelvis. The large upper leg bone is the femur, and articulates with the patella, or the kneecap. The inferior end of the femur articulates with the top of the tibia and the shin bone. Along the anterior margin of the tibia is the ridge called the tibial crest, and on the distal end we find the medial malleus, which is an inferior end to the fibula. The bones that make up the ankle area is called tarsals, and there are 7 in the ankle, with one of the 7 called callus or heel bone. The bones of the foot are referred to as feglins, with each foot having 14. Of our 206 bones, the body, 56 of them are feglins.